not always, but a lot of times there's a little bit more mobility, a little bit more laxity. And so let's just, so like, for example, if I was just pivot testing, so just if I'm going here with Haley and I was just doing the passive intervertebral motion testing, because iliac crest, I can come across, right? So if I come directly across from the apex, I'm probably the L3 spinous process. If you follow this, you're probably going to hit the curve of the crest. You're probably coming right at the L4, L5 interspace. Okay, so you just got to figure that out, right? But if there's any question, you can work down, and I should feel motion, right? I should feel motion between L3, L4. I should feel motion between L4, L5. I should feel motion between L5, S1. But then on the majority of patients, there shouldn't be any motion between S1 and S2 unless they have a lumbarized sacrum, okay? All right, so anyway, but so with flexion, like I can get Haley all day long. Like there's a lot, like I'm still, like I can get her here and I still have flexion. Like I really have to get her way up here. Like here, this is where I'm feeling the gapping. So that's way up there. So for her, I probably would prefer a top down first. That's just the first step one. There's still a step in the process. It's just step one, we're gonna rotate. So, okay, so let's say that we were gonna go approximately L3, L4 again. So what I'm gonna do with Haley is and I will have a patient, I'll say, okay, I want you to take this arm, take that hand, grab behind my elbow on my arm. Just grab it back there and just relax. And now I'm gonna use her arm, just relax. And I'm gonna rotate her to there. I feel rotation and opening at that level, L3, L4. I'm gonna reach under here now so that I can monitor this space again with my middle finger. Now, I'm gonna still do the same thing, okay? I'm gonna come now with Haley. Okay, I'm gonna have you scoop forward a little bit more. Check this out. Grab behind my arm. Relax right here. Now I'm gonna still come up and I'm gonna get, now I feel it, the flexion is engaging a little faster. So right there. I'm gonna pin her, tuck her foot. Now for me, I'm gonna come up on top of Haley almost. So I am thigh to thigh with her, coming like this. And again, I'm gonna take up the slack, take up the slack, take up the slack, and then,
Ooh.
okay? Okay, all right.
This was.
And then recheck whatever it was that we want to do. Go back. You want to see it from the other side.
Very
You guys, bend.
So for the top that we go for set locks and then
I don't know that we would. I don't know if we would term it a facet lock. Will we term it a facet lock with the rotation?
So I think how it's termed and how Paris and Patla them are introducing it, I guess we're doing the ligaments lock first in the order of how they're presenting it. So I guess the ligaments lock in this case would be, well, you can look at it both ways. It could be from top down, ligaments lock, and facet lock from the bottom up. Or you can look at it this way, with the ectomorph. Let's look at it this way to be on the safe side. With the ectomorph, we can look at it. I'm just saying, look at it this way. As if we create a facet lock first, and then the ligaments lock second. Due to the person being hypomobile at the lumbar spine. Yeah, hypermobile.
I'll look into that a little bit. In the cervical
me too.
spine, it's pretty clear. When you side bend, it's pretty clear that those facets are locking down on one another. It's a little harder to. I'll have to do a little research.
We talk is for.
I had Nyberg for S4.
I had Nyberg too. I had to email Nyberg and ask him. I emailed Nyberg. I got his email. He practiced in the clinic in Atlanta, the spine clinic.
So technically, it doesn't really matter what body type you are. If you have hypermobility, you start at the top.
if you don't feel like you're getting, if you are like way up here and you're still feeling like you're having trouble engaging it, then I would try top down.
Okay,
Yeah.
you just say
Regardless
based
of
on
height.
line types because usually they have the hyper. Okay, okay.
So for
And
meso-
and it's a frame issue too. An endomorph has a bigger frame. Okay,
Right.
they've got a bigger frame, so you may be able to engage what you want to engage. Somebody with a smaller frame, you may have to take them farther to be able to engage what you're trying to engage.
Yes, ma'am.
So, but mobility plays into it as well.
Thank you.
You guys good, ready to try that?
All right, it's almost